When we care for brain-injured patients, we often speak about neuroplasticity. In other words, the way the brain heals and adapts to change. Connections in our brains are formed, strengthened, and weakened based on experiences, such as learning to communicate, moving our arms and legs, as well as participating in everyday activities. We used to believe our brains were hardwired from an early age. We now know the brain constantly adapts throughout life. These connections regulate how we think, feel, move, and act. After a brain injury, some connections can be damaged or lost. However, our brains are resilient and can reorganize through neuroplasticity. Select Medical's expert team of doctors, therapists, and neuropsychologists focus on the relationship between our thoughts and behaviors. Together, these skilled professionals conduct evaluations to measure behavioral and cognitive changes resulting from brain disease or injury, like stroke or disorders that can affect how we move and how our brains process information. Once the care team has assessed a patient and created a care plan, they work collaboratively with the patient to achieve the best outcomes possible. Each professional focuses on a different part of the patient recovery process. A therapist understands brain injuries and the stimulation required to create new or restored lost connections. Therapists trained in neurological, behavior, and cognitive sciences can help patients regain their abilities using motor, sensory, psychosocial, and other treatment techniques that focus on meaningful functional activities. Under the therapist's guidance, skills learned through one activity can apply to another. For instance, a physical therapist focuses on reconnecting parts of the brain that control movement. This can help patients relearn a variety of movements, tasks, such as how to move around the house, get the mail, or walk the dog. Meanwhile, an occupational therapist focuses on developing and/or restoring motor, sensory, psychosocial skills that are necessary to perform functional activities, such as getting dressed, feeding oneself, or returning to work. Speech therapy focuses on restoring the brain pathways responsible for communication, thinking, and swallowing. Communication includes the planning, coordination, and muscle control to create speech sounds, help us understand how we hear, and to tell others what we are thinking. We can spark motivation in patients with the help of our recreational therapists who tap into a patient's personal interest. At their core, the activities help manage stress, develop healthy coping and social skills, and increase self-esteem. Recreational therapy activities range from artistic expression, drama, music to dance, sports, games, and community outings. Select Medical's network of rehabilitation hospitals and brain injury specialists provide dedicated care to patients. We develop individualized, evidence-based treatment plans for each patient, tailored to their conditions and goals. Our critical illness recovery hospitals work to care for and help patients begin their recovery. Our inpatient rehabilitation hospitals help patients strengthen their bodies and regain independence. Select Medical's outpatient centers continue to build on a patient's recovery foundation with speech, physical, and occupational therapy treatment options tailored to each patient. Our goal is to be there with each patient every step of the way, strengthening their mind, body, and spirit.